Hi there, my name's Nicole, and I'm going to go over some guidelines to vaccinating your pet. So, the world of vaccines. So, today we look at animals as part of our family. Sometimes most Americans can't live without them, and yet not everyone is educated on the vaccines that can help prevent our loved ones from suffering. Through many studies, we are shown that normal house pets can benefit from vaccines. Let me show you the main reasons why paying a little fee can benefit your loved pet. With strict guidelines, we can now see the variety of vaccines at a lower cost. There are two different kinds of vaccines, core versus non-core vaccines. Core vaccines are those that 99% of veterinarians are going to recommend. This, for a puppy, would include the parvovirus, the bordetella virus, and the canine rabies virus. For kittens, you're looking at the feline panleukemia, feline upper respiratory, and feline rabies. So, this all depends on the type of exposure. So, non-core vaccines are those that you as the owner and the veterinarian have at your discretion. These will depend on the exposure risks that many animals will have. By looking in your area that you live and talking with your veterinarian, you are able to have a better decision for your pet. There, I will give you the guidelines. So for a dog, we like to see them vaccinated at 6 to 8 weeks. They get their first distemper parvo. This is going to be a 3-series vaccine. 3 to 4 weeks later, when they are 10 weeks old, we are looking to do a distemper parvo booster, and we are looking to do the bordetella vaccine at that time, which is the kennel cough. Then at 16 weeks, we'll do the third booster for the distemper parvo, and then we will do the rabies vaccine at that time. Then they will be vaccinated from all those horrific things that you hear about for 1 year. Then, after that, they are boosted every year. We are now able to offer our canine companions a 3-year rabies vaccine after they have their first one. They have to have one prior to getting the 3-year vaccine. So with cats, what we are looking at is kind of the same guideline. Looking at 6 to 8 weeks, we would do the feline panleukemia vaccine, which is basically the feline distemper. And then at 10 weeks, we would do a booster of that, of the feline panleukemia and the feline respiratory disease. Then at 16 weeks, we would do another booster of the panleukemia vaccine and the feline rabies. Vaccines can be done depending on your veterinarian every year or every 3 years. It's all going to depend on basically the lifestyle of your pet. These are only general guidelines as vaccine types recommended, and the frequency of vaccines vary depending on the lifestyle of your pet being vaccinated. Indoor versus outdoor travel plans, kennel boarding plans, and underlying disease conditions such as immune diseases and pre-existing infections such as FIV, which is the feline AIDS. But by working with your veterinarian, you're able to have the best plan for your animal. Studies have shown that animals that get their vaccines live longer, healthier lives. When you purchase an animal or adopt an animal, you are taking on that obligation to take care of that animal. This entails proper grooming, diet, exercise, and veterinary care. Many animals rely on you to keep them in good health. While proper care can offer many animals better lives, with regular vaccines can keep them from getting any fatal illnesses like parvo, rabies, distemper. A puppy's first vaccine ideally should be given at 6 to 8 weeks and continue over a period of several weeks up to 16 weeks. Afterwards, you booster every year, and this will protect your dog. Indoor versus outdoor. What you need to know that could help save their lives. With animals being able to roam outside, they can come in contact with many dangers, such as other animals that can expose them to illness such as rabies, which we do see in raccoons. and your dog and or your cat can receive. Now, depending on your area that you live with, even bugs and insects can infect them. So with um, heartworm, you can get that from a from a mosquito. So definitely look in your area to determine if keeping on heartworm medication would be highly recommended. Also, flea and tick. We do see that we can provide them with a flea and tick solution once a month that will prevent fleas and ticks. So definitely look in your area to determine if that is also something you would need. In our area currently in Idaho, flea and tick is highly recommended. We are very infested with ticks, and we do see quite a few flea infested dogs and even cats come into our clinics. With heartworm, definitely something that I would always recommend to a client. It is definitely sad to see a dog and or cat go through heart failure due to heartworm. Also, we definitely see that if animals, such as our cats and dogs, get into any other fecal matter of any other animal, we can get giardia, which comes from standing water. You can get roundworm and hookworms from fecal matter as well. So definitely talk to your vet regarding your outside pets. One of the most common causes of a parasite infestation in our animals is through fecal matter, such as cysts that are shed from other animals into their feces. The most common of transmission is actually waterborne, as a parasite prefers a cool and moist environment. Up to 50% of young puppies will develop develop an intestinal infection, and up to 100% of dogs kept in kennels will develop exposures to these as well. We definitely see a lot of kennel cough come out of our shelters due to the fact that they are in close confinement with one another, and it's hard to keep that exposure down. They can be treated on a regular basis. Definitely check with once your pets get into the senior category, which would be 7 or older, we definitely recommend every 6 months getting checked up. This is just to get early detection on any diseases. Our local shelter is trying to help our community by offering low-cost vaccines. The Idaho Humane Society has great offers for those who have low incomes. They also will perform spay and neuter and give great vaccines at a considerably lower cost. We also offer a program called SPOT. This is Stop Pet Overpopulation Today, which offers spay and neuter to feral cats and bully breed dogs. So this is a pit bull for only $10. They also give vaccines for $10 as well. Many of these programs are offered all over the country. This is something I'm very proud to offer my assistants to. Looking at the way the world has slowly evolved and how diseases have learned to adapt, without proper vaccinations, our pets that we considered our loved ones may suffer. I have shown you these. You can definitely get these at your local veterinary hospital. This is a guide to vaccinating your dog. This is also a guide to vaccinating your cat. They go through helpful tips of what each and every thing is, what are the symptoms that you may see. So definitely something you can pick up at your local animal shelter and or veterinary hospital. It doesn't cost you anything extra. So I hope that this persuades you to go out and definitely get those vaccines done for your pets. They will live longer and you will be able to see diseases a whole lot sooner if you get regular checkups. Thank you.